The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
The rotator cuff is a group of 4 muscles. These muscles are attached to the top of the arm bone. The muscles wrap around the front of the ball and socket joint and attach by tendon to bone. The muscles wrap over the top of the ball and socket joint and attach by tendon to bone. And the muscle wraps around the back of the shoulder and attaches by tendon to bone. These 4 muscles work together to move the ball in the socket, and that is the mechanism by which we are able to move our arm in space, to position our hand in space to perform our daily activities. The most common problem we see with the rotator cuff is a tear in the rotator cuff tendon, where the tendon is detached from the bone. That is what physicians refer to as a rotator cuff tear. In all of us, our rotator cuff tendons age, and as the tendons age, the tendon fibers begin to break down. As the fibers break down, patients can develop small holes in the rotator cuff. Those holes can get bigger with time. Physicians refer to that as a rotator cuff tear. Even though it doesn't happen suddenly, it's more of a slow, progressive problem. As the rotator cuff becomes thinner and becomes weaker, it's much easier for the rotator cuff to tear when we lift heavy objects, or sometimes when a sudden jerk is applied to the arm. Patients who have rotator cuff tears commonly complain of pain located over the outer side of the shoulder. The pain commonly radiates to the mid-arm and occasionally to the elbow. Patients with rotator cuff tears will complain to the physician about pain with their arm in certain positions, particularly reaching overhead, extending the arm out to the side, or reaching to the back. Night pain is a particularly common complaint in individuals with rotator cuff tears. Patients will commonly complain of pain that interferes with their ability to sleep. They will commonly tell their physician, "I cannot sleep on my affected shoulder," or "If I am asleep, my affected shoulder will awaken me at night with achiness." There are a variety of non-surgical treatment options. Physicians frequently advise the patient to modify their activities to pain tolerance, which is to say, asking the patient to avoid those activities that aggravate the shoulder pain. Physicians commonly prescribe medications such as anti-inflammatory medication or acetaminophen for pain management. Heat seems to be a treatment choice to relieve pain. Commonly, we will refer patients to physical therapy for a program of shoulder range of motion and strengthening exercise to see if we can improve the function of the shoulder and hopefully the comfort of the shoulder. Many patients associate cortisone injections with shoulder problems. When we're dealing with a rotator cuff tear, we have to be cautious and thoughtful about using steroids, because steroids tend to further weaken the rotator cuff and can create a bigger problem in the long term. When the non-surgical treatment choices are not effective in relieving shoulder pain, surgical management is an option in properly selected patients. The surgery typically involves using a small lighted tube known as an arthroscope to look into the shoulder through very tiny incisions And by the use of the scope, we can visualize the tear, and then through other small incisions, we can actually reattach the tendon back to the bone from which the tendon is torn. It involves using sutures and other devices called implants to reestablish the normal connection of the tendon back to the bone. The rehabilitation following rotator cuff surgery typically involves a very carefully planned program of shoulder exercises are designed to gradually over time restore a patient's range of motion and restore strength in anticipation of restoring function to the shoulder. Certainly some patients are better candidates for rotator cuff surgery. Patients that do the best with rotator cuff surgery or have the best surgical outcomes tend to be those individuals that are in reasonably good health. Smokers tend to have much poorer outcomes in terms of shoulder replacement surgery. There are certain medications that tend to slow down or limit the body's ability to heal a repaired rotator cuff. These medications would include steroid medications and chemotherapy drugs or agents. Those medications tend to slow down the body's ability to heal. So those patients that have the best surgical outcomes tend to be individuals that are in reasonably good health, who are psychologically well adjusted, and who are highly motivated to participate in the rehabilitation program after surgery.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.